Hi, I'm Logan. I'm a student nurse.
Hi, Logan.
I've been assigned a patient, Ronald Harvest. Can I have a report on him?
Sure. So he's a 67-year-old male, weighs 171 pounds. He has no known allergies. He's a full code. He's been admitted by Dr. Phillips. His primary diagnosis is a stage 2 diabetic ulcer on his right heel. His secondary diagnosis is diabetes mellitus. He's presented today complaining of increased blood glucose reading for the past 5 days, with results consistently in the 300s, and a non-healing wound of his right heel that he noticed approximately 3 weeks ago. He's a type 1 diabetic, 20 years. He has a pressure ulcer. He tried to soak it in salt water, but that wasn't helpful. Um, his doctor has ordered IV blood sugar checks at meal times and before bed, with insulin to be given on a sliding scale. He's also been ordered wound care. Clean and irrigate the wound with 0.9 normal saline and cover with clean, dry, sterile dressing now and then twice daily until the patient is seen by the wound care nurse. The wound care nurse consult should evaluate and treat the wound. Should be irrigated. Doctors ordered Simvastatin in the evenings, gabapentin, MPH, regular insulin, and urinalysis is pending. His last set of vital signs were temperature 98.4, respirations were 18, pulse was 80, blood pressure was 145/72, and his O2 sat was 95 on room air. He has a new lesion on his right heel. He states that it's not healing. It's been becoming painful. His skin is dry and intact except for the stage 2 ulcer on his right heel. The wound is 5.5 centimeters by 2.5 centimeters at the largest diameter and about 3 centimeters deep, extending to the dermis. The wound base is pink. There's no tunneling or undermining noted. And there's a moderate serosanguinous exudate. His neuromuscular checks 5 out of 5 for muscle strength in all extremities. There's no clubbing, cyanosis, or edema to any of the extremities. The patient pulses were palpable. He's been admitted to an inpatient medical unit for glucose control, diabetic teaching, pain management, and wound evaluation and care. And he's also been ordered a consult with the wound care nurse. Plan to dress the wound with dry sterile dressing tonight and will collaborate with the wound nurse and the team regarding the best wound care plan for the patient and his wife at home.
Okay. What specifically is, or why specifically is this client receiving this medication?
This client is receiving this medication to help control his blood glucose levels. He is a type 1 diabetic, which means he doesn't make his own insulin. And insulin is usually what lowers the amount of glucose in the blood.
Okay. What action does the medication have on the body?
Well, insulin helps trigger the uptake of sugar by the cells, so it lowers the overall amount of sugar circulating in the body.
Okay. When should you question administering this medication?
You would question it if the patient's blood glucose was low, like extremely low, then we would question it, withhold it, or adjust the dose.
Okay. Does the medication have a therapeutic serum level?
Yeah, usually when how we know it's working, we check the blood glucose levels, and if it's in a therapeutic range between like 80 and 100, then we would know that it's taking effect.
Okay. And which vital signs must be monitored?
All vital signs are essential, but particularly for insulin, we want to monitor the blood glucose, the capillary blood glucose, because we want to make sure that the medication is taking its effect.
Okay. And which physiological parameters should be monitored when medication is being administered?
You want to make sure the patient is alert and oriented and is not showing any signs of hypoglycemia, which are like sweating, confusion, or rapid heart rate, or has any rash or any adverse effects of the medication. We would want to monitor closely for that.
Okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
We want the patient to be familiar with their medications, to know their usual, so that way, like, to prevent errors, and we want to teach them how to rotate the sites to eliminate the bruising and the irritation of the skin area, the injection.
Okay. And then what interventions must be taught for taking the medication safely at home?
Well, at home we want to teach them how to safely administer the medication into their body, and we want to teach them how to clean the site properly to prevent infection, because when you're injecting it, you're breaking the skin barrier and therefore you're increasing the risk for infection. And we also want to teach them how to rotate the sites each time, just so their skin wouldn't get irritated or they wouldn't end up with lipodystrophy, which is fat lumps appearing on the skin. That's an adverse effect of insulin.
Okay. And what are the side effects and potential adverse reactions?
So side effects and adverse reactions, we have rash, we have signs of hypoglycemia, so tachycardia, diaphoresis, confusion, might be bruising at the site or irritated skin, and possibly infection if the technique wasn't clean when they injected.
Okay. And how will you know the medication is effective?
We would monitor closely for the capillary blood glucose level to make sure it's in the therapeutic range. That's how we know medication is effective.
Okay, that's all my questions.
Okay. All right. Well, I'm about to administer medications, so want to observe?
Yep.
Okay. All right. You want to knock on the door? Of course. Hi, my name is Nazmia. I'm going to be your student nurse today. Can I get your name and date of birth?
Ronald Harvey, 67.
Okay, and do you have any allergies?
No.
Okay. I'm just going to double check that in the chart. So it's Ronald Harvey, 67, and no known allergies. Okay. I'm going to wash my hands. For the procedure. Okay, so have you had anything to eat today?
Yeah, I actually had a snack about 15 minutes ago.
Okay, good. Because you're due for your insulin, and your last blood glucose reading was 290. So that's pretty high. So we're gonna need to administer insulin. We have the regular insulin due, and we have the Lantus. So, are you familiar with the side effects and adverse reactions of insulin?
Not really. Could you go over them with me?
Absolutely. So, major things you might see is you might develop a rash. That would be like an adverse effect. Or you might go into hypoglycemia, which you might get confused. You might get a fast heart rate. Or you might start sweating a lot or not knowing what's going on. Also, you might get bruising or irritation on the site of injection. So I need you to monitor closely for these signs, and if you encounter any of them, just let me know as soon as possible, okay?
Okay.
All right. So I'm going to pull out the meds. So we have the regular insulin, and we have the Glorgi and Lantus. I'm just going to pull them out. I'm going to be giving the regular insulin first. So here goes the regular insulin. I'm just going to compare it to the MAR. So the regular insulin, going to make sure it's the right patient. So, I see your bracelet one more time. Can you tell me your name and age?
Ronald Harvey, 67.
Okay, and you said you have no allergies, correct?
Right.
Okay. So, insulin is due 2100, so about now, and it's sub-Q, and the dose is going to be 16 units per the sliding scale, because his blood glucose is 290. All right, so, and I want to just double check with the pharmacist drug guide to make sure that these cannot be mixed or crushed, which I see like they can't be. So I'm gonna have to give 2 separate injections. All right. So put my gloves on. Okay. All right. So you wanna scrub the top. I'll make sure there's no germs on there. And then pull out. Okay. I'm going to draw out 16 units of air. It's because we're giving 16 units. Checked it. Push in the air and then pull out 16 units. Do you want to confirm that?
Yep. 16.
Okay. So we want to recap and double check one last time to compare the medication, the 5 rights of medication. So we want to check his bracelet.
Ronald Harvey, 67.
Okay. And the right medication. I'm going to check in the chart. So it's Ronald Harvest, regular insulin. For the sliding scale, it's going to be 16 units, sub-Q, and due about 2100. So right now, I'm going to make sure to check the expiration date. So expiration date is March 3rd, 2018. So it's good and looks pretty clear. And you said you don't have any allergies, correct?
Correct.
All right, I'm just going to double check that on your arm and in the chart. Okay. All right. Well, now we can administer the medication. Okay. First, I'm gonna need to scan your barcode, but the scanner isn't working, so I'm just gonna have to put it in manually. Okay, so patient ID. This one. Okay, and then I'm gonna put in the code for this. C C 7 B 9 E0 B A 4. Okay, so we have the green light, which tells us that this is the right patient and the right medication for that patient. And sub-Q and for a sliding scale is going to be 16 units and the time is 2100, so right now. Alright, so now we're ready to administer the medication because we verified it on the computer. So, going to scrub and pinch a little, 90 angle, out, and then disregard it, sharps container. How are you feeling?
Good.
Alright, so just gonna document and sign. Put in the comments that it was sub-Q. Sub-Q 16 units. Blood glucose was 290. In abdomen. And then I'm gonna save it. Alright. So now we're gonna pull out the next medication in here, which is the insulin glargine. So I'm gonna pull it out from the drawer. Okay. I'm gonna put this one back in. So we're done. Alright, so I'm gonna compare this one to the MAR. Okay, so it's glargine, and this one it's 18 units, also sub-Q at bedtime, so it's about 9, so it's time for it. And yeah, so we want to make sure the same thing. So I'm gonna do my patient identifier. So give me your name and date of birth.
Ronald Harvey, 67.
Okay. Do you have any allergies?
Nope.
Okay. Alright, so I'm gonna just put in your, instead of scanning the barcode, I'm just gonna put in the number. And then I'm gonna put in the number for the medication. And also make sure that the expiration date is good, which is March 4th, 2018, so that's good. And that it's clear. And looks good. I'm just gonna put in the code for it. Okay. Oh. Made a mistake in the barcode. Pick this one. Okay, so now we have a green light. Alright, so I'm just gonna prepare the medication now. I'm gonna scrub the hub and I'm gonna prepare. Oh, forgot to pull out 18 units of air. So I'm gonna do that. 18 units. Okay. I'm gonna put it in. Push the air in and take out 18 units. Okay. So we have 18 units here. Do you want to double check it?
18 units.
Okay. Let me safely recap it. And verify medication just one last time. So, can you give me your name and date of birth?
Ronald Harvey, 67.
Okay, and do you have any allergies?
Nope.
No, okay, I'm gonna double check that in the chart. So it's Ronald Harvey, 67, no allergies. And we have the correct medication, insulin glargine, and we have 18 units, sub-Q, due at 2200 about now. And, yep, so we can now safely administer medication. And again, scrub the area. We're going to use a different site than we used before, just to prevent irritation and lipodystrophy like I mentioned earlier. Okay. So, a little pinch, 90 angle, Okay, then I'm gonna disregard it. Okay, and I'm gonna take off my gloves. How are you feeling?
I feel good.
Okay. I'm just gonna leave some comments here. The administration time and the administration site. So sub-Q, sub-Q, and upper right quadrant in the abdomen. 18 units. And then I'm gonna sign it, my initials, A, and hit save. I'm also gonna, there's no assessment that I need to document at this time, but I'm going to document the medication teaching. So can you tell me the side effects that I told you earlier and the adverse reactions over insulin?
Some of the side effects are bruising and redness at the site, and adverse reaction would be if I feel sweaty or my heartbeat starts going really fast or I get confused.
Or a rash. Alright, well, I'm gonna hand you a written material so you can have something to reference to later. So there's a written material that you can look at your leisure. And do you have any questions for me?
Nope.
Alright. Well, I'm going to continue my documentation here.
Alright, and I had a few more questions for you.
Go ahead.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I had to look at his last blood glucose reading to make sure that it is in a range where it needs insulin, and so the patient won't go into hypoglycemia.
Okay.
So that's what we had to review.
Alright, did this information affect your decision to administer the medication?
Yes, of course, because if his blood glucose was too low, I would have withheld it or adjusted the dose, because we don't want to send him into hypoglycemia.
Okay. And did this information affect how you administered the medication?
Yes, I had to review the patient chart and make sure it's the right patient and the right medication and why he was receiving it. And also I had to verify his last blood glucose reading and make sure that he ate so I can administer the medication safely.
Okay, that's it.
All right.
Thank you.
Thank you.